Assalamualaikum and hi, my name is Nur Ain Farhana binti Adnan. I'm from MGT340G7. I will explain about problem. Since the beginning of 2019, the coronavirus has hit the whole world and including our country. The virus continues to spread from one place to another place. Due to that, there are some things that had to be changed and stopped to prevent the spread of COVID-19 from continuing to spread in our country and other countries. Many things have been done by our country so that we Malaysians can live in a normal state again. For example, the authorities have closed school and university for a while, prohibiting people from cross-country movement control order had to close some sectors and others. This is implemented so that COVID-19 cases do not continue to increase every day in our country. Not only that, due to the pandemic, COVID-19 has resulted in changes to the working arrangement of millions of employees who are now based at home and may continue to work at home in some capacity for the foreseeable future. Concerns regarding the virus' immediate and long-term effect and impact on the employee health and well-being have been arise not just in our country but also around the world. There are several current issues that happen to related to human resources management in Malaysia, which is the employee health and well-being at work during COVID-19. The health and well-being of employees is very important. This is because if an employee is ill, not only their health is affected, but their work is also be affected. Therefore, we must be more concerned about our own health in order to live a quality life and work. Healthy individuals will be able to contribute to the development and prosperity of the country. This study attempted to identify the impact, and how to overcome of employee health and well-being at work during COVID-19 happened.
I will discuss about the problem. The pandemic COVID-19 is basically affecting both the employees and also the human resource management health. This actually happens since the employees are directed to work from their home during the period of time the Movement Control Order (MCO) by the government. The purpose is basically to prevent the rapid spread of this pandemic, also to maintain social distancing between the employees. Since employees are obligated to work from their own home during that period of time, this actually can create impact for their mental and also their physical health. As the impact for the employees, they tend to get stressed out, burn out, and overwhelmed easily. The reason is because they have to combine their responsibility as a worker and have to fulfill the needs of their family at the same time. The heavy workload, along with the unsuitable environment, causing them to have poor work-life balance and could lead them to absenteeism. Next is also affecting the human resource. This has happened because usually the organization generally establish wellness program to offer the employees security, health benefit, and adaptability to assist them to overcoming health challenges, whereby human resource able to understand their behavior in an office setting and can assist them in dealing with the challenges. During this pandemic, proper communication channels has been severely hampered. It makes the human resource clueless to monitor and assist the employees, and as a result, it could be harder for them to adapt the situation, so it's even harder for them to understand the behavior or the progress of the employees.
I'm going to explain the existing solution to the problem from the government. The pandemic of COVID-19 had affected many people in Malaysia. Many people had been asked to do everything online, which includes the employees in Malaysia. During this COVID-19, it has proven that many workers are having weak mental health problem because of hard to focus on the work with the environmental problem, having to work alone at home without co-workers and many more. It had affected both physical and mental health of the employees during this situation. The first solution are Due to the situation, on the 22nd of May 2021, the government came up with a solution and announcing that they had decided to start a rotation system on the WFH policy, which is work from home policy. The rotation system or rotation schedule whereby the employees will take turns coming into office and working from home. Employees will take turns to go to the office, and if they only need something to do that requires to be present in the office. While the company must make sure that meeting will only be held online for safety purposes and for less contact with other people to hinder from the virus to keep on spreading. The head department must plan all the orders by planning the attendance of staff required in the office and at home beforehand. But of course, everyone are ensured to follow the standard operating procedure SOP to prevent the virus from keep on spreading, according to Tan Sri Muhammad Zuki Ali from the Star article. It is ensured that people who are vaccinated are the only ones that could go back to the office to lessen the virus from keep on spreading. Other than that, the people with family are encouraged to go to work as they could focus more at work and only focus on the children at home. This method that the government had came up with are really effective as it could stop the virus from keep on spreading and could help the workers' mental health as well. Workers will have less mental health and physical health problems as they could focus their work at the office like usual again. Be able to balance their work and set their time properly on working from home or in the office. Other than focusing, the employees could also lessen the pressure by working online and quickly done their job directly from the office and does not need to bring it home again after that. Other than lessen the number of people affected, the rotation system also works when if there is something happen to the people who present in the office. Only people who are present in the office are being checked and quarantined, while the group working from home will not be checked as they are not present in the office. They could also lessen the number of people affected. This solution by the government are really effective to help the employees from having physical and mental health problems.
Next, due to this COVID-19, a lot of people are affected in terms of financially, educationally, and career, especially mental health issues like are isolated from their family and friends. According to the Royal Malaysian Police, there was an increase in suicide death recorded in 2020 with 631 occurrence compared to 609 in 2019, where in 2019 Malaysia had 5.8 suicide deaths per 100,000 people according to Global Health Estimates data by the World Health Organization (WHO). If this depression is not effectively detected and treated, the risk of suicide behavior increase. That is why the government also came up with another solution where every year on September 10, World Suicide Prevention Day is honored while Mental Health Day is observed a month later on 10 October. The International Association for Suicide Prevention's IASP theme for World Suicide Prevention Day 2021 is creating hope through action. The goal is to promote public confidence in playing a collaborative role in suicide prevention and to remove the stigma associated with suicidal conduct. This theme will be utilized until 2023, while the national theme for World Suicide Prevention Day on 2021 is Let's Stop Minda Sehat, Bertindak Segera Harapan Terbina. According to the Mental Health, Substance Abuse and Violence Injury Prevention Program of the Health Ministry Disease Control Division, this focus on the public responsibility in prevention suicide, particularly during the pandemic. Theme was chosen to emphasize the significance of collaborative effort at all levels to fight suicidal behavior in people, families, communities, stakeholders such as policymakers, all government and private organizations, and NGOs.
Hi, my name is Nur Sarafinas binti Rizalman. I'm going to present how to solve the problem of employee health and well-being during COVID-19 in Malaysia. First of all, creating a timetable for yourself as an employee is one of the solutions that can solve the health and well-being problems of workers who work from home. By setting your schedule for today and the day to come, this schedule can be made of things that need to be done for the day, including having specific hours that need to be working. This is because creating a schedule can help an employee manage their time better and focus on their work. With a daily schedule, daily life will be easy as it is organized and time will be well taken care of. It can also reduce stress on employees. Other than that, after finishing working, an employee can pursue their hobbies as well as take time off can be a solution to this problem. Doing something that makes you happy and finding your own happiness. An employee can pursue their hobby by doing what makes them happy. By doing something that they like, it can help them not to think too much about what matters. An employee can also take a break from work and do something they love. Meanwhile, taking time off from working allows employees to take a break from work and for the sake of their health. With this solution, as employees, their mental and well-being will be maintained.
Assalamualaikum and greetings. I'm Ifi Hazel with student ID 2019-664-296. My part is I'm going to continue in identifying ways to solve health and well-being issues associated within employees. The last point in order to solve these problems is the company should provide health insurance that helps protect an individual or family from financial loss or costs incurred because of sickness or injury. Why I said so? It is because business that offer health insurance as part of their employee benefits package are able to attract more qualified applicants than those who don't. This is especially a fact when industry competitors of like size in the same general area of health insurance benefits. In the health insurance, the company should include a wellness program as a package that usually includes a variety of health-related efforts, such as exercise programs, nutritional counseling, and medical assistance. Overall, this leads to a healthier workforce, which are frequently associated with a happier and more productive workforce. As a result, wellness initiatives can help reduce employee stress while also improving job satisfaction and morale. Thank you.